the clinical manager of the Wound and Hyperbaric Center. Tell me a little bit about what your role is, and I want you to also take a little bit of time and talk about your staff and all the different services that the Wound Care Clinic and Hyperbaric Center offer.
As manager, I'm over the staff. We have an LPN and one RN. We have some MAs and CNAs, and of course a receptionist. So I manage them, and I'm over the financial piece of the clinic. The services that we offer are outpatient as well as inpatient. So if we have a patient admitted in the hospital that has a wound that the hospitalist or another physician would like us to look at, then we'll go up and do that and follow it while they're in the hospital. And outpatients are referred by physicians in the hospital and other areas in the county. And then we either Dr. Nail or Dr. Pedersen will treat those wounds. And our healing rate is about 3 months on average, which is a good rate for chronic wound healing. We also provide ostomy services, and we help patients who have new ostomies with post-op care and answer any questions that they have about that.
Okay, explain to me what ostomies are for those that don't know what that is.
Okay. People who have cancer or for some reason have to have part of their bowel resected or removed. Temporarily they have part of their small or large intestine out through the abdomen, and they their waste goes into a pouch. And usually these are temporary, so we help them with that. And the emotional trauma as well as how to take care of it.
Right. So really, not only are you skilled and knowledgeable and have a lot of education with how to help people, but you also deal a lot with the emotional side of helping patients heal and get better. Tell me a little bit about that.
Well, these wounds being chronic, we get to know these patients very well. They almost become like family, and that's one of the most rewarding parts of wound care is knowing that you're helping someone through a really hard time.
And there's probably deal with a lot of emotions, I would think, like with frustration on the patient's part that they're not healing and they're having a lot of discomfort, and you help them through that as well, I'm sure.
Mm-hmm. We do. Yeah.
So tell me, what's the most rewarding part about your job? You said that it was, making a relationship with the patients, but what else is great about your job?
There's always something new to learn. With every patient comes different challenges. Working with other staff that have the same interests that I do, I find that really exciting and fun, and we have great physicians to work with too.
That's perfect. When you're happy at your job, things are really good. Yeah. Now, the wound clinic has been here with Logan Regional Hospital for about 10 years, if I'm correct. But it's really expanded. Now you offer services Monday through Friday, and also the hyperbaric chamber. Tell me a little bit how that has changed and how your patient intake has grown.
Obviously, being available Monday through Friday, it's more convenient for people who need to come in on a different day. And so our volumes are growing, and it's just been a more expanded service to the community.
Okay. Are you also able to go into the homes of people that need wound care, or do you do those services outside of the clinic?
We're not licensed to go into the homes, but we work closely with the home health agencies in the valley. And they're all really good. They have great wound care nurses, and we act as a resource if they need help.
Okay, that's terrific. So what has been the most rewarding part about your job as far as helping someone to have a long-time wound that finally heals? What's that like?
Well, we actually give them a T-shirt that says, "I'm a sore loser." That's really fun. It's just something they can wear, and it's kind of a play on words, and it's just a fun thing that finally it's healed, and here's a little gift. And a lot of times we'll give them to the spouse as well, right, because they put in a lot of time and effort as well to help their spouse with the healing.
Well, and you have to spend a lot of time educating the patient and their caregivers on what to do to help the healing process. Tell me a little bit about that.
We have handouts on every kind of dressing, every type of wound, and physical condition that causes these wounds. And that's also a rewarding part, is teaching and providing information. I think it helps the patients feel more at ease, and when they have a really good understanding of the wound process and the healing process.
It helps to give them encouragement. Education helps to calm them, and also helps them to feel secure in the treatment that they're giving.
Yeah, it does.
That's terrific. Well, to get more information on any questions about wound care or the Hyperbaric Center, Cynthia is one more person that you can talk to. Thanks, Cynthia.
Thank you.